The amoxicillin worked and relieved some swelling. I spotted blood in my stool, also determined to beat this. I returned to Northside Medical Associates on August 13th and asked for a stronger antibiotic, doxycycline. I told them I believed I may have a parasite-based infection such as filariasis. I traveled and lived outside of America where I may have been exposed to this and others via mosquito bites, ingesting unclean water, unclean food, etc. I said I had pain out to my left ear. It felt like fluid. He looked in my ear with an instrument and confirmed fluid from some swelling mass of infection, and it was parasite activity. I told him I went to St. Vincent's East Hospital, Ascension Health in Birmingham, Alabama, and they misdiagnosed me, overlooking my broken skull. The only reason I had been to any doctor in over a year. This is the only reason. The doxycycline might have saved my life. It took out the infection to a large degree. I scheduled a cervical MRI with Northside within days. Okay, this place is off of Deerfoot Parkway in Trussville. They got their own MRI machine, and guess what? It takes real good pictures. Really good. You're going to get to see them. Wow. So the doxycycline may have saved my life. It took out the infection to a large degree. I scheduled a cervical MRI with Northside within days. $500 cash. They had their own machines. They got more than one machine. The MRI staff were not very friendly, not very people friendly or accommodating to my neck injury. That's the technicians that run the MRI machine. If I'm going to get a neck MRI and a MRI machine, I may have a very serious injury there. So they asked you to lay down on this uncomfortable table, and it might be kind of difficult for some people, especially if you're sick. They seem to kind of not be aware of pain factors and just my overall comfortability. Is that a word? Okay, well, I'll make a new word. My comfortability. So they didn't seem to take into account whether I was comfortable or not in their cumbersome MRI machine. All right. Okay. I had to lay on my back for 20 minutes in this machine. And I was scanned. The results are as follows. Study description: MRI spine, cervical without contrast, ordering diagnosis. Cervical GIA, M54 reason for exam, M54.2, cervical GIA, MRI, cervical spine without contrast. Clinical history, neck pain findings. The cervical spine demonstrates appropriate alignment without significant spondylolisthesis. There appears to be mild end plate changes anteriorly at C4, C5. However, the intervertebral displaces fairly well, maintained without disc protrusion or significant spinal stenosis. The neural foramen are patent. The cervical spinal cord inserts appropriate morphology and signal intensity. No epidural collections identified. Impression: the MRI of the cervical spine is essentially unremarkable without disc protrusion or significant stenosis. This is electronically verified report, 8/15/2019, 11:20 a.m. Michael Brant, Ruff, MD, transcriptionist, MBR, reading radiologist. Michael Brant, Ruff, MD, radiology. St. Vincent's radiologist analyzed pictures. I returned to Northside Medical on August 29th to dispute the results because they didn't read what I just read out to me. I took the MRI. I went home. A few days later, I got a call, and they said MRI looks normal. And then I'm like, well, hey, wait a sec, something's not right. You just say it's normal, and that's not what they're saying here. They said it's normal. The people at Northside Medical. But if you go in and you ask them about the MRI procedure, they'll tell you, we're not involved with that. That's next door. So they use these word games to displace responsibility. And very, 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 very interesting the way they handle themselves.